We will talk about brain aneurysm or cerebral aneurysm. It's not common condition, but if it occurs, it's highly lethal and highly fatal. That's why it's important. Brain aneurysm or cerebral aneurysm is bulging or ballooning in the artery in the brain. Most common type is berry-shaped aneurysm. You can see it looks like berry, and it is called berry aneurysm. If this aneurysm will rupture and bleeding occur, hemorrhagic stroke will develop. So 85% of hemorrhagic stroke are caused by ruptured aneurysms. And if aneurysm ruptured, there is 50% of chance of death, and even person will survive. 30% risk of lifelong disability. So if brain aneurysm will rupture, it's highly fatal and morbidity is very high also. Fortunately, brain aneurysm is not common. It affects around 2 to 3% of world population. It's more common among females, 3 to 2 ratio, and usually brain aneurysm is asymptomatic. In 90% of cases, no symptoms at all. And if aneurysm is not ruptured, and if it's small, less than 7 mm or 10 mm, it is considered small aneurysm and usually no symptoms. And in many cases, just observation is enough and no need any intervention. But if there is symptoms can be headache, vision problems, seizures, numbness. It's highly dependent where is the location of this aneurysm. If aneurysm will rupture, there is sudden severe headache and often described as the worst headache of my life. So people say that it's worst headache of my life. That's how we can detect ruptured aneurysm. And symptoms develop fast, rapidly: nausea, vomiting, stiffness, sensitivity to light, and loss of consciousness, and death in many cases. So urgent treatment and urgent detection is very important. Now here's question that what percentage of aneurysm is stable and what percentage will grow. Most aneurysms, around 70% of cases, they are stable whole life, and person will have aneurysm and will die and still same aneurysm, and this aneurysm will not be caused in 70% of cases. But in 30% of cases, aneurysm will grow and eventually it can become large enough to have some symptoms. Now let's say about causes. What is causes of aneurysm? Usually it's congenital, and congenital factors have higher number, but purely genetic it's around 30% of cases. The mechanism is weakening of artery wall and this bulging develops. Hypertension is responsible on 35% of cases. Atherosclerosis is responsible in 25% of cases. Other risk factors include such as alcohol consumption, sedentary lifestyle, smoking, aging. So if we say three most common causes, it's congenital, hypertension, and atherosclerosis. And we already said that berry aneurysm is most common type. Berry aneurysm looks like this, berry shape, and it's most common type, 80% of cases, and highly associated with genetic factor is important, and it has also high probability to rupture. For berry aneurysm, rupture probability is 1% per year if it's smaller, and if it's bigger, more than 10 millimeters, then probability of rupture is 10% per year. So it needs urgent treatment and detection, of course. Now let's say about diagnosis. Golden standard of diagnosis is cerebral angiography, and you can see this cerebral angiography on the image, and you can spot this berry shape aneurysm. And CT scan also used, and magnetic MRI scan, and CT angiography also. You can see CT scan of the brain aneurysm here. And what is treatment? Gold standard of treatment is considered surgical clipping. You can see this clip here, and it's effective method, but it's more invasive method. And less invasive method is endovascular coiling. You can see inside aneurysm is coiled, and blood clot developed, and this aneurysm is sealed. So it's treatment, and highly effective, less invasive, and interesting advanced treatment actually. Prognosis is generally good if it's not ruptured. Prognosis of ruptured aneurysm is bad, of course, but before it ruptures, treatment effectiveness is high. And sometimes if aneurysm is smaller than 7 mm, in many cases observation is enough. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.